What's up, guys? Acosta here to discuss synovial joints. So synovial joints are found between articulating bones that enable us to move. So some of the components of synovial joints include the articular capsule on the outside, the synovial membrane, as well as the synovial fluid, which is found in between both of these articulating bones. So there are 6 different types of synovial joints that we're going to discuss. And so as we go through this lecture, we're going to categorize each of them and talk about the movements that are allowed, as well as the location of where these types of joints are found. This pencil is representing the x-axis or the transverse axis. So this is where rotation occurs. And the movement that goes along the plane, so this plane is the sagittal plane. So if you look at it, you can see the sagittal plane. Remember, once again, it divides into right and left halves. So this movement here is flexion and then extension. So flexion and extension. So this is in the x-axis. So now let's look at the y-axis. So you have the y-axis or the longitudinal axis. So rotation is occurring here. And what plane is involved here? If you look at it, the plane is dividing it into the top and the bottom. So we'll see that this is the transverse plane. So this is where movement is occurring here along the transverse plane. So then now if we look at it from here, so this is the z-axis, and look at the movement that's occurring here. So what plane is that? So it's dividing into the front and then to the back. So this here is the frontal plane. So let's go ahead and write that here on the board. So you have the x-axis or the transverse axis, and the plane that's involved includes what? Which plane is it? It's the sagittal plane. So you have movement along the sagittal plane, and it's what? Flexion and extension. So then now if we move to the y-axis, remember once again this is longitudinal axis. The plane that's involved includes the transverse plane, and you tell me, what movement is it? You have rotation. So now let's look at the z-axis or the sagittal axis. So movement is occurring what plane? There's only one plane left. The frontal or the coronal plane. The movement is abduction and adduction. Okay. So now that we're familiar with the different movements that occur along these planes, let's now get into the 6 different types of synovial joints. The first type of synovial joint that we're going to discuss is what's known as a plane joint. So it's non-axial because there's no rotation along an axis. And the movement that's involved is a gliding motion. So gliding occurs. So if I was to draw the plane joint out, you'll see this flat articular surface here articulating with another one. So there's only gliding movement in between them. So what plane is involved here? There is no plane because there's no rotation along an axis. So then now some of the different examples for a plane joint. So we'll start with the axial and then work our way towards the appendicular. So starting with the axial, first off you have the sternocostal. So this is between the ribs and the sternum. You also have the costovertebral. So this is between the vertebra, or this is between the ribs as well as the vertebra. More specifically, this is within the thoracic vertebra. The next one, you also have the intervertebral joints. So intervertebral, so this is just the stacking of the different vertebra, where the superior and then the inferior articular facets. So then now we have these 3, so now let's move on to the sacroiliac joint. So the sacroiliac is between the sacrum and the pelvis. You also have the acromioclavicular, so this is also known as the AC joint. The next one you can mention is the patellofemoral joint. So this is between the patella and the femur. So then a couple other examples include the intertarsals. So that's in between some of the foot bones, and as well as the intercarpals within the wrist. One other joint to mention is the superior tibiofibular. So that's in between the tibia and the fibula. Okay, so let's take a look at some of these examples, see what I was talking about. Okay, so first off, I have, so this is C1 and this is C2, or this is C1, this is C2. So they're stacking on top of each other. And you can see, remember this is the inferior articular facet, that's the superior articular facet. There's only a gliding motion that's occurring there. So remember, this is a plane joint. So the next one, another example to include is, remember once again here, this is the sacrum, this is the ilium. So you have the sacroiliac joint, which forms there. And you also talk about the carpal bones, so in between these, this is just a plane joint. Okay, so those are a couple of examples for the plane joint. So now let's look at the uniaxial synovial joints. So remember, once again, there's rotation along only one axis, and the first one we'll discuss is the pivot joint. So the pivot joint, the movement that's involved for a pivot joint is rotation. So rotation occurs, so I draw the bone here. So this is the bone within which axis would this be? This is the y-axis. So rotation is occurring. And you have this sleeve here. So this sleeve is kind of keeping that bone in place, and it's allowing it to rotate. So which plane is involved here? So it's rotating along which plane? If it's on the y-axis, it's the transverse plane. So you have the transverse plane in which movement is occurring. And then some of the different examples for a pivot joint include the Atlantoaxial joint. So this is between the C1 and the C2 vertebra, as well as the radio ulnar joint. So this is at the proximal end, as well as the distal end. So let's take a look at that. So the first one that we said was the C1 and C2. So if I have this here, you can see the dens here on C2, and then you can also see the facet for the dens right there. So you can see that rotation is occurring here to this side, and then you also see the rotation along this side. So that's one example. Then you also have the elbow here, the head of the radius, articulating with the ulna. So so this is called pronation. So as it rotates in this direction, you see the rotation, and then it also happens here on the distal radio-ulnar joint right there. Okay. So that's it for the pivot joint. Now let's move on to what's known as the hinge joint. So the hinge joint, so if I draw that out here, this is the articular process there, articulating with a concave-like structure there for the bone. And the movement that is involved, you have flexion as well as extension. So rotation is occurring along the x-axis. Right, so rotation is occurring along the x-axis, and which plane is it going to be? It's going to be the sagittal plane. So movement occurs along the sagittal plane. A couple of different examples for the hinge joint include the humero-ulnar joint. So this is between the humerus and the ulna. And then you also have the temporomandibular joint. So this is between the temporal bone and the mandible. Another example, you have the tibiofemoral as well as the tibiotalis. So this is here in the ankle. So if we take a look at it, we take a look at it, you can see this here is the trochlea, and then the trochlear notch is found here on the ulna. So as it articulates like that, right, this is flexion moving upwards, and then this is extension moving downwards. Okay, so that's for this one here. And then I also have, so this here is the femur. So femur up here, tibia here. It's functioning as a hinge. And then you also have the tibio, so the tibio-talus joint, that's right there. Okay. So now let's move on to biaxial, where we have rotation along two different axes. So a couple of examples for biaxial. You have what's known as the condylar joint. So the condylar joint has this oval-shaped projection here articulating with a concave bone there. Some of the motions that are allowed include just it's similar to the hinge joint. You have flexion and extension, but you also have abduction as well as adduction. So we're moving it in this direction along the, first off the sagittal plane, and then if we move it side to side, this is, so let me write sagittal. You also have the frontal plane in which movement is occurring. So some of the different examples for the condylar joint, you have the Atlanto-occipital joint, so that's between the first vertebra and the occipital bone. And another one includes the so the radius and the carpals, so the radiocarpal joint. And I'm going to write the proximal radiocarpal. The proximal radiocarpal joint. So let's take a look at that. So the first one, the Atlanto-occipital. So this here is the C1 vertebra. You can see the articular facets there, and then it's articulating with these occipital condyles. So here that's forming a condylar joint. So you have flexion and extension, and then there's slight abduction and then adduction moving in this direction. So you have this one, and then also the wrist here. So if you look at it in the anatomical position, so we'll look at it from here, you can see flexion as well as extension, and then this would be adduction, and then abduction is moving away from midline in this direction. Okay. So those are a couple of examples for the condylar joint. The next joint that we have is, so you have the condylar, and then you also have the saddle joint. So the saddle joint is shaped just like it's described. So you have, let me draw it right here. So you have, here's the saddle, and then you also have the saddle here. So it's fairly similar to the condylar joint in that you do have flexion and extension as well as abduction and adduction. So nothing changes as far as the planes in which movement occurs. The difference here is that due to its shape, it has a restricted range of motion compared to the condylar joint. So some of the examples for the saddle joint, you have first off the sternoclavicular, so the sternum and the clavicle articulating together. And then you also have, besides the sternoclavicular, you have the carpo-metacarpal joint. Carpo-metacarpal joint of the first digit. So this is the thumb. So those are two different examples. So whenever you're looking at this name, just remember, so the carpals are here, and then your metacarpals are there. So when we say that the carpo-metacarpal joint, we're referring to this particular joint right here between the carpals and then the metacarpals. So that's a saddle joint. Okay, so the last synovial joint that we have is something which is known as a ball and socket. So ball and socket joint, it's shaped like this. You have the ball, and then there's the socket there, this concave-like structure. And the movements here, we have flexion and extension, abduction and adduction, as well as rotation. So the movement along the different planes, you have sagittal, frontal, as well as the transverse plane. So this is probably the easiest joint to remember. You have the humeral, so the coxofemoral joint, so this is the hip, and then the glenohumeral joint. So the glenohumeral joint includes the humerus within the glenoid cavity. Okay, so that's going to do it for this lecture.